We can now go back to Joy News' request for information from the Ministry of Health, which has hit a snag. According to the Right to Information Bill, you can access information from any media house. Now, let's look at the response that is coming from, because that information we requested was from the Agenda 111 project. So this is our request for information about Government's Agenda 111 project. It's on your screen right now. Pursuant to the Right to Information Act 2019, Act 989, I write to request access to information held by your office with the following details. Now, it says 1, copies of the policy or policies underpinning the project, which is Agenda 111, detailed project proposal including feasibility studies and funding sources secured. 3, list of all districts where projects will be sited, detailed plan for commencement and completion of each of the projects, and 5, detailed plan for staffing and operation of each of the hospitals. So this is the request that came from Joy News, and it was submitted by Raymond Akwa, who is head of research desk. Kindly supply the certified copies in a PDF file and send via mail to me at raymond.aqua@myjoyonline.com, or send hard copies to the undersigned at the designated address, yours in the service of humanity. And you can see that it was forwarded by Raymond Akwa, who is head of research desk at Joy News at Multimedia Group Limited. Now, we can now look at the rationale behind our request to the ministry. And I'm joined in the studio by head of research desk, Raymond Akwa, who actually requested for that information, but was declined that information. Raymond, let's first look at why this project is important.
Because that's perhaps government's biggest project in the area of health, proceeding from the year 2020 to 2021. Let's not forget, even way back in 2019, we had plans of building hospitals. But in 2020, remember the President of the Republic of Ghana said at the height of COVID, it exposed some of our difficulties across the country when it comes to healthcare provision and the infrastructure in this area. So we planned to do some 8-8. Later on, it became a bigger, bolder government agenda, launched, properly put out there, stipulating that we are going for 111 hospitals. The conversation started with where we are getting the money from and all of that. But later on, government came in to tell us that we have secured $100 million for this project. So the discussions about how much is involved, the discussions about what is the policy document underpinning this entire project. And we're also told, if you even check the Ministry of Health's website, indeed, there was an implementation committee, which is chaired by the Chief of Staff, that was also put there. So in fairness, we actually submitted letters to the Ministry of Health, that particular implementation committee, and also to relevant state institutions we may think may have similar information. All that we've been asking is which policy or policies underpin our quest to build 111 hospitals. 2, we needed to find out whether we are fully secured, because we've been told some 100 million will come on board. We first were told that some 600 million was supposed to be used, that cities were supposed to be used for this project, which really was interesting because of the budgetary conversations we've had over this. Okay. So have we secured the money? How much of that has been spent? And what's the status of implementation of this project? So we also wanted to know the big outlay. There have been snippets of information from government institutions and ones put out there. And one of the things you should know also is that people ask, so why the health ministry? Because just 2 months ago, on the 11th of January, the health minister himself actually told us in the media press that some Agenda 111 projects were facing challenges, but government's on course. Okay. Don't forget, the president led the project. He went to actually cut the sword for the commencement of some of these projects. That's information from the health minister. You don't need to go far into the health ministry's website to see some of the things that the ministry itself tells us is happening in connection with this one. In fact, it was that ministry that released that statement and said, government has secured 100 million startup fund for Agenda 111 projects. And this was at a similar event that the minister spoke about, the status of the project. So there are full details that also was submitted by this same ministry. All that we wanted to find out is, beyond this snippet of information, is there, for example, a document ready proposal that stipulates exactly what we want from it. That details all of this, so that it's not like what we are getting from the various government institutions. That's why we send a letter asking them some of these specific informations and for the information to be supplied. The alternative, of course, they have 14 days to reply. So with time, they came back that they would reply. So then this was their reply.
What was their response?
So it's pretty simple. They came back with a direct response saying that they do not have the information in their custody.
Okay.
If you need me, read exactly the words there. And it's important because this is the chief director who is speaking directly on behalf of the substantive minister for the ministry. This is exactly what the response which was given said. It's dated the 21st of March 2022. Okay. And if you can see it even on our screen, it says that RTI response. This is about your letter dated February 11, 2022 on the subject request for information about government's Agenda 111 projects.
Yes.
Per our records, we do not, that's their response. In fact, that's the most important part. Right. Per our records, that's the records of the ministry, we do not have the information in our custody. And thank you, the Abna Boedu Okuafari is the chief director. He signed on behalf of the substantive minister. The minister who not long ago, 2 months ago, had actually come out to tell us the challenges they are facing in the implementation of the program. The minister who had released the statement about the 100 million being secured and used to project it. Let's not forget, amount of money secured and used to project is part of things that we are also asking. We're not just asking for what has been put out there in the office, because official information is different from what may be put out there indirectly into the public domain anyway.
So now that we don't have the information, this definitely would affect what you seek to do with that information.
All that we seek to do is to track progress, to understand the program properly and track the progress. Most of what we do in this republic has been that we embark on projects, but ideally projects beginning will come from some documents. The documents are evolved into what government reviews and is approved at the various levels. And now we have project proposals properly done, and feasibility studies across the country on all of the one sites or which other place we want to put them to know where the projects will be, how we're going to be done. And we also ask a question, which is important too. After we build them, how are we going to staff it? And what are the plans to deal with that? All of these questions have been on the minds of people. Our job was to find information and inform the people. In the interim, we may not be able to get the information from the people that we thought had it. We will press forward and ask other government institutions if they equally have anything, or ask them to give us the information if they have it in their custody, so that we can share with the people that we supply information to all the time.
Our viewers. And definitely it's something that we should look out for, because these are nagging questions that need responses. Raymond Akwa, thank you for bringing us that update. He's head of research here at JoyNews.